Dr. Poornima Prabhakaran, she is the additional professor and head of environmental health and deputy director of the Center for Environmental Health at Public Health Foundation of India. Poornima's work focuses on research, training, advocacy, capacity building, and remediation for environmental health. She's also associated with the Center for Chronic Disease Control. Thank you so much for joining us, Poornima, today this afternoon to have this discussion. Our next panelist, Dr. Arun Sharma, as Radhika already mentioned, he's the director with ICMR's National Institute for Implementation Research on Non-Communicable Diseases based in Jodhpur. His background and experience comes in community medicine and healthcare administration. His current research interests are environmental health, spatial epidemiology, chronic respiratory illness, One Health, and zoonotic diseases. Well, could not be more timely to have this discussion. Thank you so much, Dr. Sharma, for joining us. And last but not the least, we have Neeraj Jain. Neeraj ji is the Parks Country Director for India. He has more than 27 years of extensive experience in strengthening organizations, setting up new ventures, organizational developments, and market development. Neeraj ji has provided strategic leadership for change management in organizations across Asia and Europe. Thank you so much to all three of you for taking the time to join this discussion with Earth and Climate Trends today.
This pandemic has exposed India's public health infrastructure, or rather the gross inadequacies therein. And I wanted to stop for a minute and step back and take a reality check. Pre-pandemic India, a young, growing economy, 1.3 billion population and growing, a large portion of that population in the 0 to 14 years age group and the 25 to 45 years are literally our demographic dividend, the current and the future. Life expectancy of about 70 years, about 943 females for every 1,000 males. In terms of some health indicators, we have about one doctor for every 1,500 people, 0.55 beds per 1,000 population, half a bed for 1,000 population. That was the stark reality. About 18 lakh beds across our infrastructure, health infrastructure, about 7 lakh of that in the public health space and about 11 lakh in the private health sector. And what was our budget for health? We had about 1.3% of the GDP allocated to health. What more can I say? It took a very unforgiving viral pandemic to lay bare this public health infrastructure and bring it to the center of the discourse. And really, I mean, what are we possibly failing to do here? We are failing to take cognizance of another pandemic that has been creeping up on us literally over the years, and now with greater momentum and is literally, like you said, in our backyards. As we continue to deal with this pandemic over the last 18 months, large parts of the country also continued to face acute climatic events, cyclones, floods, droughts, heat waves, deteriorating air quality, and all of these are going to be accompanied by a surge in disease burden. We're going to face more of respiratory diseases, cardiovascular diseases, adverse birth outcomes. We're going to have nutrition and water sanitation related health morbidities, and not to forget mental health. So are we prepared? Is India's public health infrastructure prepared to face this existential crisis of climate change? And this is not rocket science. All of us know the answer, unfortunately, is no. So we have huge lessons to learn from this pandemic. The public health infrastructure in India definitely, doubtless, needs to be strengthened. And we need to rally around all our resources, our minds, what have you, everything to do this and to do this right. And unfortunately in India, there are several factors at play. I mean, India has a very, very diverse health system, far removed from a UK style national health service, which is like one health service that is catering to its population. We in India have a very unique health system. We have the public health system, we have the private health system, we have the armed forces with their verticals, we have the railway hospitals, We have the Ministry of Labor that looks after its own employee state insurance hospitals. So how many hospitals and healthcare facilities are we talking about here that need to be strengthened, and all of them with different governance structures? So it's not going to be easy to evolve a strategy to address the gaps in healthcare in India or the access to it, but there's simply no excuse not to do it. And so while we talk about how we approach this, I think there has to be a dual approach, both top down as well as bottom up. And top down, because certainly we need to lean back on the national programs and the policies that are being evolved over there, as well as the allocation. I mean, those programs and policies definitely need to show us the way, but also the allocation of resources that needs to go along with it. And the facilitation happens from the national level. But in India, health is a state subject. So really, it is also action at the ground requires a decentralized approach. So every state really needs to kick in all its machinery to prepare a customized response in preparation and adaptation for climate change and the accompanying disease burdens. And also we need to recognize that we are a very diverse country geographically. Every state has its own climate vulnerability. So really, I think that's where we need to start from. Every state really needs to take stock. What are our own climate vulnerabilities? And what is a baseline health assessment is what we need. And when I talk about a baseline health assessment, it's not just our infrastructure, not just how many healthcare facilities we have, but also in terms of our personnel. It's like, under a certain, the Swachh Bharat mission, you construct the toilets, but you don't have the water. You can construct all the health facilities you want, but you need to place your personnel there and equip personnel who are aware of what climate change can do to the communities and be prepared to handle those diseases. And I think apart from that, healthcare is not like, the buck doesn't stop here. It doesn't stop with just the health sector. Healthcare delivery is a very, very coordinated response that occurs across sectors. We need not just healthcare and the healthcare personnel and all the actors that go with that, but also I think a very good continuous supply chain for your drugs and your pharmaceuticals. You need a good transport system. You need your resources, energy, water, all of that comes into play. So really, every state needs to sit back, take stock of their situation, do a baseline assessment, what your vulnerabilities are, both in terms of climate hazards, but also where you stand in terms of your own healthcare. And I think what is key is not just structural resilience, but also functional resilience to respond to acute climatic events.
Humans and animals are encroaching onto each other's space. And whenever there is an encroachment, it causes hostility. The familial or favorable interactions happen in the domestic circuit when you have pet or when you have poultry or when you have the milk producing animals as our partners. That's a different scenario. But if you look at the events that has happened in last few years, I want to point out that among the emerging infectious diseases that we have talked about in last decade, in last decade, 60% of them have been caused by zoonotic pathogens, and 71% of these zoonotic EID events were caused by pathogens of wildlife origin. So these two, figures tell us that how we are being threatened by our interaction with the wildlife. Now look, when we say One Health, philosophically speaking, we mean that the planet belongs to all living beings equally. So they have all equal rights on that. But human beings, by virtue of their intelligence or exceptional powers, they have started encroaching upon the land which belongs to the rest of the animal world and the plant world. Right. Now, what is the solution? The solution is there has to be a harmonious relationship. In that harmonious relationship, one of the dents that happen is that animal kingdom also suffers from diseases. Plants also have their own threats and pathologies. Now, these are being studied by so-called 3 different categories of specialists. So you have human medical doctors, you have veterinarians, and you have plant biologists, so-called plant biologists. And there is no dialogue, there is no communication, and there is no interaction between these 3 set of, I will say, professionals who do not interact with each other. And that is the biggest, stumbling block or biggest barrier between approaching the issue of One Health as an integrated phenomenon. What we need to do is, as you rightly said, that post-COVID, the conversation has started, the buzz about One Health has started, because it is in the common knowledge that now, okay, the disease has come from the animal kingdom, maybe from the bats or maybe from the exotic animals, though not proven, but it's a very strong hypothesis. And that has made people take note of it. Now, if this continues, it will be a good sign. What we need to do is, we need to start exchange of data that is available with the veterinarians and the plant biologists and the human public health specialists.
How do you perceive at this moment are India's health policies adequate to address the future health risks? And what kind of diseases would unfold as the climate crisis worsens? Where do you see the gaps currently?
In terms of the policy environment, frankly, as it stands today, if you were to ask me, are our policies adequate to even address the health crisis? Probably not. We've all sort of faced that. But having said that, if I were to further go into climate, of course not. There is really very little interlinkage between climate and health and what's happening there. I think in terms of the health system, there are lots of inequities. Access is a big inequity. Quality of the healthcare infrastructure, which Poornima talked about, huge differences between rural and urban, public and private. So those differences are extremely visible and extremely glaring. I think the challenge is that our health system is mostly focused around the curative. It's mostly focused around people getting sick and how do we take care of them. So the preventive somewhere falls off the map. I mean, the preventive starts from clean water. It starts from good sanitation. Climate is a very, very important part of that preventive. For the first time, health is now a political subject. I presume that there will be elections being won and lost on the issue of health, which wasn't the case up till now. It's also a very important economic subject. I think one is being able to predict how are we going to use the intersection of health and climate to start predicting more effectively in terms of what we could expect in terms of disease, in terms of growth of disease. And I'll go back to basic malaria. I mean, basic vector-borne diseases. Even there, we are not actually using any of that data yet. There are some models that are being built around, which are artificial intelligence based, which are starting to predict certain things by overlaying climate maps, etc. But that's an important area that we should be focusing on going for now. The other is in terms of our whole primary care, the front end of our primary health care, which is going to be absolutely important, and it also interlinks very closely with the whole climate conversation. So that primary healthcare will have to be strengthened. The policies around that need to be strengthened. How are we doing diagnosis? How do we have early warning signals in terms of health that start showing up? What really probably needs to be done is a more strategic, coordinated, and well thought out response that brings all these factors together and starts looking at it more as a whole rather than a single area. What is the connection between climate and health? And the first thing that comes to mind is the mosquito. Yes, that is the first thing, because as climate changes, we've seen that. I mean, for years, for decades and centuries, we know that when the monsoons come, the mosquitoes increase. When the mosquitoes increase, malaria, dengue, etc., etc. And I don't need to tell the audience about that. But it's not just there. And we really need to do something about this. And it's going to be very important for the policymakers to look at that and start building that to try and put it all together. Otherwise, the preventive will be lost and we'll constantly struggle with the curative.
Climate change, or even air pollution for that matter, has never been a part of medical curriculum or even the nursing curriculum, and allied health professionals have never learned it as part of their medical curriculum. So there's a huge concerted effort right there that we need to do to make some change in the capacity building or the training of our doctors and healthcare professionals. And while that happens, I think a consistent effort to sensitize the healthcare professionals, as it were, already the trained doctors, if they are not going to realize what this new abstract thing of climate change, they can understand air pollution, that is more relatable, but climate change is still an abstract concept for a lot of people. And one of the levers that I have found is talking about air pollution. It is one of the dimensions of climate change. And policies and pollution norms are being revisited. There's lots of action that's going on in the policy space. So health sector voice is considered a very credible one. And according to the WHO, the nurses are even more revered. So there's a huge role for the health sector professionals to mobilize their collective action, starting not just in the policy space, make a huge push for health in all policies. I think that's really important in all the discourses that are happening to bring health into those conversations.
Most of the developed countries do make their data of the health sector available to all researchers. And there are, of course, ways that you make it unidentified, you make it unlinked, anonymous data sets, because we are not interested in the health parameters of an individual, but we are interested in knowing collectively of a population, where it does not really hamper the privacy of the phenomenon. So the health department, or for that matter, health ministry, in spite of being part of it, I will say, must come forward and make the data available in a way which can be utilized for scientific interpretations and without compromising the privacy and secrecy of individual person. This is doable. This is not undoable, and that has to be made available in public domain so that we make more important analytics out of it and generate more knowledge.
Data of impact, data and translated into money value is very powerful, and I would strongly want to see more of that, linking climate with public health and using this opportunity of COVID to really make some large strides.